What do you think are the most serious issues facing nursing education right now? I mean, you mentioned that we're just not producing good teachers. We've gotten away from emphasizing that. And then what do you think over the next decade we really need to look at?
Well, I really think we have to start teaching all of our graduate students, master's, doctoral, PhD, D&P, all of those different students. We need to really teach them how to teach. They need that in order to be good stewards of the discipline, and whether it be patient teaching or student teaching, that needs to be incorporated in the graduate studies. We also really have to upgrade the situated teaching of science. We need to upgrade our prerequisites in science, but we're recommending that that prerequisite teaching be a very integrative clinical focus on teaching. We recommend that pathophysiology and physiology be taught together because that's how they're used in nursing, and that we really emphasize being very selective about the in-depth science teaching we need to give our students, which of course now is considerable with genomics, with really understanding hemodynamics and oxygen transport and sepsis and immune system. I mean, there are a lot of things that nurses have to know in depth and really well. And we need to have an in-depth focus. We came out with two mantras that we really agree, and a lot of educators agree, that really deep learning is so important and less is more. If you give a kind of superficial gloss over a lot of topics, that's not a very effective way to teach. And yet, in academia, we're very prone to teach about things rather than teaching how, teaching when, and integrating it into actual situated knowledge use. And we really do view knowledge use as much more than mere application of theory. We view it as very dialogical, and it's a form of very productive thinking. It requires creativity, it requires perceptual acuity. So there's a lot to teach with knowledge use, and our older, narrow, rational, technical models of how we think and how we use knowledge, we think are inadequate.